Huples Cat. Harshman Hills, excellent channel. He's been doing a really great series on healthcare workers he knows and works with, and he's asking them a bunch of questions related to the flu pandemic. And he kindly asked Kitty if she would answer some questions for him. So I have shot this video, and it's going to go to Harshman Hill first, and then once he's got it up, I'll put it up as well on my site. It's kind of interesting. I tried to get as much of Kitty's face as possible so you can see her responses and her reactions, the unsaid ones, and I didn't give her any previewing whatsoever of the questions. So sit back and enjoy.
I'm back for another coronavirus, how it's affecting different segments of the nursing population.
Huples Cat and Kitty.
Hello.
So Kitty's going to answer some questions for Harshman Hills about his great series on how healthcare providers are dealing with the COVID-19 disease. And she hasn't seen the questions in advance. So basically, are you ready?
I guess so. Hope it's not a test.
No, a test. You can answer as briefly or as honestly as you want. Okay? Oh, yeah, I'm a little bit
Yeah, I'm trapped in the car, so I can't run away.
That's right. So, first question from Harshman Hills. Thanks offering Kitty up for the sacrifice.
Oh no.
What is your title and position?
I am a staff nurse, registered nurse in the
Bit louder.
care. I'm a staff nurse, registered nurse in the critical care unit in an ICU.
What level of hospital do you work at?
ICU, intensive care unit.
Level 3 trauma hospital.
The top.
Yeah. What is the current status of COVID-19 patients in your facility as in number and severity?
I'm not sure about the facility at large. In my unit, we have 4 people under investigation.
Non-confirmed at this time though, right?
Non-confirmed. There's a couple from a cluster that was in an outpatient clinic. There's one that was exposed by a physician, and there's one that traveled to Chicago.
Right. So they're getting more and more less unlikely, right?
Unfortunately, one of the things that they're finding is that COVID screening, if it's done early in presentation, their viral load might be lower and you might be getting false negatives. So we're on the fence on them. They are not people without comorbidities. They are generally unwell people.
Right. This is me butting in.
Okay.
You mentioned to me this morning what you felt their health status was compared to normal, and you said it was dire. You said they were sicker than you would expect them to be. They were very ill all 4.
They are very ill all 4, but I have to qualify that by saying they are not able-bodied people.
To start with. Because that's the nature of the exposure, though, long-term care.
Exactly.
And doctor infecting patients, right?
Exactly. They are immunosuppressed people
right.
to some extent. They are between 50s and 88.
Right. So this is what Italy found, and then they found that it was spreading to the nursing staff. And so that's why they're now saying the most common age group to dying from this is 20 to 60. And without comorbidities, which is cheerful news, isn't it?
Birds making a nest.
Where?
Oh, carrying a stick.
Sorry about that. All right. What is the ratio of nurse to patient in the ICU?
Usually we're 1-to-1. Sometimes we have 2 patients per 1 nurse.
That's rare.
That's our
though,
standard. No, we usually have that one. If there's less acute patient, we have 1 nurse that in the unit of 20 beds that has 2
right.
patients. That's our standard staffing quota.
Right. So generally you have 20 nurses because of the charge nurse, right?
20 nurses, it's a 20-bed ICU.
Right. And you're often the charge nurse, right?
Yep.
And you also do rapid response where you're in the hospital going to see sick people, right?
Yep.
Okay. Okay, what special precautions has your facility implemented for COVID-19 that are different than a normal airborne precaution patient such as TB? Which incidentally is an awesome question.
Well, we have changed from wearing paper gowns in rooms to wearing cloth gowns. We are taking more extreme measures in terms of covering things like wrists with longer gloves. To be honest, with TB, which is airborne, we should be wearing N95 masks and face shields for any aerosol-producing procedure, and mostly we do that every time we go in the room. In this case, those are the same PPE that we are wearing with COVID. We are taking more precautions in that we are limiting some treatments. We are not doing non-invasive ventilation, which is BiPAP, and something called OptiFlow, which is a high-flow nasal oxygen supplement. We're not doing those because they're aerosol producing. We often use those to temporize and to try not to intubate patients. So we're not, if they are failing, we're not going to what we would usually go to as a step up. We're going straight to intubation. We are not, or we are minimally bagging patients, which means if you're intubating a patient, which is putting in a breathing tube to hook them to a ventilator because they're struggling, we normally cover their face with a mask and manually ventilate them to get their oxygen levels higher. It's quite an aerosol producing thing, and you're right at the patient's head and face when you're doing that. So we are passively pre-oxygenating them if we can. We are not taking crash carts completely into a room. We're taking defibrillators and a drug box. We are trying to limit the number of workers that are in a room if there's a crisis event going on, and we've defined who those people should be. We have extra help that's gowned and ready to go in outside the room if need be.
Sounds very reassuring. It's not sustainable though for more than a few patients.
It actually is not sustainable.
That's the problem. Yeah.
Because right now all of these patients are in at least single rooms, but to be honest, all of ours right now are in negative pressure single rooms, but we're at capacity now. Full.
So we're just going to take a break while we get on the highway. Here we are going onto the 404 at 20 past 6 on a Friday night. And generally speaking, traffic is about as light as you'd expect on a Sunday at 9 in the morning. Which is good for us because we can leave to go to work late. Which is also good for us because we're now doing some things differently, which will be a separate video. And now back to the kiddie interview for Harshman Hill. Are you ready, darling?
I don't know. Go ahead.
Okay, this is a fun one. Did you, as an ICU nurse working directly with these patients, receive any special training related to their care or precautions needed? Did you receive?
Well, we have videos online refreshing us on...
Loud.
We have videos online refreshing us on what we call doffing and donning, putting on and taking off the PPE we're supposed to wear. There have been some, I work nights, so there have been on days some actual training sessions. I have done impromptu training sessions with the staff. We have checklists to follow, so we've used those. We did a simulation. We've done a couple of simulations, both on days and on nights, of intubating suspected COVID patients with physicians and RTs and the whole team, delineating roles. I've done that once.
This is a fun one. What is your facility doing to monitor staff post potential exposure to COVID-19, which you've already been exposed to on several occasions, right?
Well, I don't know.
Well, I have.
I don't know for certain. It's community born. How do I know? I don't really know any better than anyone else. I haven't had a contaminated exposure with a patient event that I know of.
What are they planning to do for it? Do you know?
If there's something overt or someone is symptomatic, obviously they are not coming to work. There's a health screening survey you can take if you have symptoms at home that tells you what to do.
Are they doing any blood testing or any microbiology testing of the staff as a routine?
No.
Are they planning to?
No.
Okay. So I think you covered the facilities plan post-exposure for staff members, who's basically...
Well, you might be placed on quarantine.
Yeah.
You might, if you're asymptomatic, more likely be placed on work quarantine.
Yeah, so work quarantine is where you can't go out except for the home and to work.
And you should probably quarantine yourself from your family members.
Okay. What do you think that the government and the Canadian version of the CDC, which I guess is Health Canada, should be doing... should be doing more to assist both the healthcare field and the general public at large. So what would you like to see them doing? What would you like to see Ministry of Health doing in Ontario, and what would you like to see Health Canada doing that you're not aware that they're doing that you think would help you and also help the population?
Well, I think if I had a complaint, it might be that we should maybe have started all of this a few weeks earlier. I had a meeting this morning with my manager and educator and our staff, and it does sound like they are doing a lot of organizing, which is quite impressive. It's just a little bit last minute. Yep. So unfortunately, I think they're on the right track. I just think we might be a little bit late. In terms of self-isolation, I think, or social distancing, I think I'm only really starting to see that happen in the last couple of days, and that might be late. Our organization is maybe making some wrong choices, but at least they are making choices and trying to troubleshoot what issues are going to come up. I just think that we've had more notice and they maybe could have done it earlier. I guess hindsight will be 2020 to see if we've actually managed to avert overwhelming our system.
Speaking of quarantine, what did your mother do yesterday?
Mother had an urgent need for a motorized cat water fountain, water supplying bowl for their cat. So she went and got one. Unfortunately, she doesn't like it, and although I've told her she probably oughtn't, she may well have returned it today.
Now, bear in mind she's living in an assisted living facility and they're eating their meals in their rooms and aren't allowed to socialise.
Yes.
Right. Anything else you would think it would be good for people to know, generally speaking?
I would say that people should know that if they think they are not at risk and they think that this is being overplayed, they're really missing the point. They should be honoring these social distancing protocols to the best of their ability so that me and my 25-year-old nurses at work that are scared, that are asking me what will we do when we run out of masks, do we have to go in the rooms, don't have to face even one more patient in the hospital. That's positive, because we are doing risky things with these people. We have no choice. You have a choice. People in the public have a choice. And even if you think that it's inconveniencing you and you're feeling a bit lonely, we are in an age of technology, and communicate online, communicate on your phones. Don't go out if you don't have to. I'm not saying that everyone's not going to need something and go to the grocery store, but group your things. Try to go off hours. Try to not contact it. Because if you get it, you might not get that sick, but someone else might because of you. And we don't want you in the hospital sick and dying, because it's just a nightmare.
Thank you very much, Kitty.
You're welcome.
That video was for Harshman Hills, and I'll probably put it up on my site as well, because it's very good as ever. Kitty is excellent on camera. He didn't ask me. Don't blame him. I just want to say a few things related to that. It's pretty clear from what Italy's going through, and this is also from the media and also from ICU fellows and staff physicians that worked at my hospital who now work in Italy and communicate to our doctors here. It's worse than it's being portrayed in terms of the volume and acuity overload and also the illness. They're saying categorically the main age group that is being ventilated and dying is the 20 to 60 year old age group. That's what they're saying. Once you get over the initial old people exposed in hospitals and group homes, it's younger and younger people. They're also seeing a 4 to 5% death rate from infected people coming to the hospital. So make of that what you will. This is almost identical in terms of what we're seeing to Spanish flu in 1918. We will get over it. It will be fine. But we're going to lose a lot of people we shouldn't lose because of three things. Public being stupid, the government being in denial, and healthcare facilities not have done proper planning. And I'm probably going to do a rant video this weekend, because widespread use of surgical masks by the general population would have prevented infection spread. It wouldn't have stopped people It wouldn't have protected the people wearing the masks, but it would have stopped those who were infected wearing the mask spreading it. And even today, people are still saying in my hospital, people who are MDs, who work for infectious diseases, that there is no asymptomatic spreading, this is never airborne. Both of those things, I think, categorically are not true at this point, but they're still holding that line because they cannot accept that what they've been saying is wrong and that they will have killed people by saying it, but they have. Anyway, that's all from me. Other than to say, everything is fine. We are having our third night at work, then I'm off for quite a while, and Kitty's off for a few days, and so it goes on. And so the adaptation continues, and I will wish you all good luck. Harshman Hills, thank you for the work you're doing. It's very important. Community nursing is way more important to beat this pandemic than what Kitty and me are doing in the hospital. And yet, unfortunately, it's just being viewed as we're saving lives. We're not going to be able to save many lives. You can't stop death. But people going into people's homes and hydrating them and turning them, that will save a lot of deaths. And if you have got any skills and any ability to do so safely, figure out how to help out your neighbours, if only by dropping them off a thermos of tea or whatever, or just calling them up twice a day. It's important that we the people get out there and help people in our immediate walking area deal with this. This is not a hoax, this is not small, this is not somebody else's problem. If it's not in your home and community right now, it will be very soon. Toodles. That's it for me. I hope you enjoyed that. Make any comments you want down below. Remember that we're not heroes, we're just doing our job and somebody has to do it. And we'd rather not, but we're gonna. So yeah, there's a lot to be tidied up when you're moving a house. I don't expect to be able to sell this house this year because I think the economy is going to get a lot worse than it is right now. And people say it can't, it will. But I do think it will recover once this is all over, and we need to continue with our plans. Plus it keeps you occupied on your days off, and occupation is good. So remember, in SHTF, tomorrow will always be worse than today, unless you prep. And even if you prep and it's a pandemic, tomorrow for a while will be worse than today. So act accordingly. Keep your distance from people. It's very, very important that you don't get infected, so you don't become a patient of mine or Kitty's. It's very, very important that if you do get infected and you don't go to the hospital, which most people won't need to, you don't pass it along to somebody else who might need to. It sounds trivial, but if everybody stops talking and touching other people, there's no way this virus can transmit. Okay? Toodles. This was a 2020 Big Mr. Bear's Not That Bad a Dog production.